Thank you. The final item of business this evening is a members' business debate on motion 19675 in the name of Patrick Harvie on unacceptable waiting times for accessing gender identity clinics. This debate will be concluded without any questions being put, and I would invite those members who would wish to speak in the debate to please press the request to speak buttons, and I call on Patrick Harvie to open the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. I'd like to thank those members who have stayed a little later than expected this evening, as well as all those who signed the motion allowing us to debate it this evening. Presiding Officer, MSPs from all sides of the chamber raise the issue of waiting times in our NHS regularly. In a search of the official report from just the last few weeks alone, I saw members rightly expressing concern about failures to meet waiting times of 12 months for some conditions, 62 days in another case. A member again raising the issue of waiting times at question time today. There are so many examples, and we all understand the impact this has on our constituents' lives and the immense challenges that the NHS itself faces in addressing this problem. But the example that I am raising today is extreme. The data from Public Health Scotland mentioned in the motion and published last month illustrate a wholly unacceptable situation throughout Scotland, but in particular a service which is utterly overwhelmed at the Sandyford in Glasgow. This is Scotland's largest gender identity clinic. It's the service for 8 health board areas, covering almost half the Scottish population. At March this year, compared with the previous year, there were 3 times as many people who had been on its waiting list for more than 5 years. The clinic was offering first appointments to people who had been waiting 6.5 years. Now, a 6.5-year wait for a first appointment is bad enough, but that's not what new patients today are facing. With almost 4,000 people on the waiting list and fewer than 50 first appointments being offered in the course of a year, new patients will be looking at the situation in utter despair. At that rate, it would take 80 years to reach the head of the queue. And that's not even the worst estimate. Independent research has put the figure far higher and shown that the situation is by far the worst in any part of the UK. But whether we measure a theoretical waiting time like that in decades or in centuries is hardly helpful. Either way, it's clear that without transformational change, most people will simply never be seen. Never even get a first appointment, let alone actually receiving the health care they need. Or, more to the point, only those with the resources to go private will be able to do so. And even then, they'll find it next to impossible to get an NHS GP who will accept them and treat them. Now, all of this stands in stark contrast with the Scottish Government's stated commitments. In 2021, they committed to reform the current model of gender identity services to meet the needs of the community, bringing the service within national waiting time standards. A strategic action framework promising transformation of the service was published in late 2021, and it was due to be implemented between 2022 and 2024. As part of this, the commitment was made to test new multidisciplinary models for delivering gender identity healthcare, amongst many other improvements. How must the people waiting, year after year after year, feel knowing that such promises were made and that the situation has simply continued to fall apart? Well, many of them have told me how their lives are affected. I've heard from those who have been left with no option but to seek private treatment, including those who have been forced into debt to do so. I've heard from those who have been refused treatment from their GP or who have had to move GP multiple times. I've heard from those who are offered no support of any kind while waiting and no clarity at all about how long that wait will be. I've heard from those who suffer the distress of a complete lack of control over their own lives, not as a result of being trans, but as a result of the indefinite wait for support or treatment. I've heard from one constituent, herself a doctor working in the NHS, who was told that the waiting list was 2 years long when she joined it, only to be told as 2 years passed that it would be another 2. She's now been waiting 6 years and fears that it may be many more. Now, her description of desperation in seeking private care, as she described it, to bridge the gap while waiting, only to find that the wait would become interminable, that in itself was distressing enough to read. What I found even harder to read was her request that I quote from her experience but not use her name, saying, "I mostly just don't want to be potentially harassed at my workplace if this is linked back to me." This from someone who worked to provide emergency care during COVID to serve her community and her country. Presiding Officer, we need to recognise the context in which all of this is happening. Recent years have seen a continually rising tide of transphobia, generating hostility, fear and prejudice. We see legal demands for segregation. We see flat-out denial of trans and non-binary people's identities, of their human rights and of their dignity. We see a campaign to stir up and to weaponise transphobia, a campaign every bit as ugly and toxic as the homophobia of the 80s and 90s and the early years of this Parliament. And this campaign is coming not only from the far right, but from across the political spectrum. And in relation to the issues in the motion we're debating today, we see outright attempts to abolish trans people's healthcare altogether. Now, I know the Scottish Government doesn't intend to support that. But the position now is so severe that without transformational action, that is what will have happened by default, and the Scottish Government will have allowed it. We must not permit that. Not the Government and not the Parliament. Every MSP has constituents who are waiting far too long and waiting for us to act. They have a right to expect better. And they want to hear from the Minister today what is going to happen now to resolve this crisis, and so do I.
Thank you, Mr Harvey. We now move to the open debate. Backbench speeches of up to 4 minutes. I call Paul McLennan to be followed by Mercedes Yaba.
Thank you, Presiding Officer. And can I thank Patrick Harvey for bringing forward this debate tonight, and can I also thank Scottish Trans for their briefing. I've met with constituents on this matter, I'm sure others have. Waiting times, particularly at Sandyford in Glasgow, are far too long. Things are slightly better in Glasgow. Relatively speaking, the waiting list is around about 2.5 years, but it's still an unacceptable moment of time to be waiting for life-saving treatment and care. And I mean when I say that, life-saving treatment and care. Now, my constituent stated to me, this waiting time is often after gatekeeping by GPs. Patrick Harvey mentioned that as an example. My GP first refused, and I only got referred after I saw another GP 2 months later than that. People will unfortunately die from suicide on these waiting lists, and the importance of gender-affirming care can't be understated. We should obviously look into more move towards an informed consent model of trans health care. And this was approved at last year's SNP party conference, which trusts trans people in our assertion of who they are and which doesn't rely on a medicalised approach. Now, currently, we have to prove, and this is again being stated by a constituent, we have to prove that we have gender dysphoria, which is not every trans person has, in order to access treatments like hormone replacement therapy or surgeries. Additionally, trans health care should be more integrated into general health care, and I think that's a really important point. And again, stating from the constituent, my GP, current GP, well, kind, has no idea what he's doing when it comes to either my hormones or referrals to other services. Partially as a result of this segregation of trans health care, and partially due to systemic and societal stigma and discrimination, trans folk and LGBTQI people face worse health outcomes than within the NHS overall. Bear with me a second. So what needs to happen? Other health boards, and I think it's a really important point as well, must begin to take responsibility for their trans and non-binary patients. I think we talk around about postcode lottery in some NHS care, but this is really important when it comes to this point. There's only a couple of health boards that really do that. So the current model of having a small number of services covering large areas of Scotland simply isn't working. Other health boards must begin to provide gender-affirming care to their patients within the health board. The Scottish Government also must look to provide funding and support for these new services in different health boards. And I look forward to seeing what the Minister says on that particular point, and do so on the basis of these services trial new models of care in line with the new standards that have been developed and learning from successful pilots in England. The Scottish Government, and there's obviously this funding, this is an issue from Scottish Transit have raised, should ensure that the transgender knowledge and skills framework can have the maximum impact possible in terms of increasing the number of staff working in gender identity healthcare. The commitment of the Strategic Action Health Framework that trans and non-binary people were most hopeful about was a commitment to pilot new services that tried to deliver gender identity healthcare in more modern ways with less reliance on specialist centres. This should be a key focus of Scottish Government funding and support moving towards. I think trans people and non-binary people in East Lothian deserve access to healthcare and are currently in a situation where many die before they receive it. This means that they are going without the healthcare they need to live happily and healthy lives. Many are having to put themselves under significant financial strain to access private healthcare or having self-medicate without medical oversight. The fact is that a situation like roughly half of trans and non-binary people in Scotland find themselves in such a after such a significant piece of work to improve these services as unacceptable. I look forward to hearing the Minister's response to the debate later on. Thank you.
Thank you, Mr McLennan. I call Mercedes Villalba to be followed by Maggie Chapman. Ms Villalba.
Thank you, Deputy Presiding Officer, and I'd like to put on record my thanks to Patrick Harvey for bringing forward the motion for debate this evening so that we can have this time in the Chamber. I'd like to use my time this evening to raise a constituency case with the Minister. I've already raised it with her in the past, but I think it's important to get the details on the record because they really highlight a lot of the issues and concerns that Patrick Harvey raised in his opening speech. My constituent contacted me in the summer of 2022. She'd already been referred 2 years previously, in November 2020, to the Adult Gender Service by her GP, and she got in touch saying that she was in considerable distress. She'd had to wait 2 years and accrued significant personal cost of pursuing a private alternative. She said to me that, quote, "I found it necessary to go down the private healthcare route as the NHS waiting times are 3 years minimum and more likely 5 years. I thought the only way I'm ever going to get any of my life is to take things into my own hands." So she decided to go private, as I've said, but still to try and pursue through the NHS, as is all of our rights, to have healthcare free at the point of need. But she said, quote, again, "Anytime I try to contact them, I get the same reply, which is that I'm on the waiting list and will be contacted when I reach the top. But the list seems to get ever increasingly longer." Now, I was shocked to hear that it had already been 2 years without any indication of when she would reach the top of the waiting list. So I raised this with NHS Tayside, and I was told that the provision of gender identity services was being reviewed by the Public Health Directorate of the Scottish Government with the aims of improving waiting times, improving support available to those who were on waiting lists, and also to deliver new models of gender identity healthcare. And then following this, finally, late 2022, my constituent finally received first assessment, and she was then placed on the medical review waiting list at the Glasgow Adult Gender Service. Now, fast forward to this summer, 2025, so 5 years since she was initially referred, and my constituent was still no further forward on the waiting list. And remembering what she said to me, that she was thinking 3 years minimum, more likely 5 years, well, it's already been 5 years and there's still no end in sight. So I raised it once again. I contacted the Sandyford referenced in Patrick Harvey's motion, and they unfortunately couldn't provide an approximate date. They conceded that they couldn't comply with the 18-week referral of treatment guidance. They also outlined that the gender identity services have been under considerable operational pressure since 2014, so it's not a new issue, but that it has also experienced unprecedented demand which has outstripped its ability to provide appointments in a timely manner. So I escalated this case to the Minister. She may remember, but I appreciate she has a lot of cases across her desk. And while she did confirm that the Scottish Government's ongoing commitment to improving the access to and the delivery of NHS gender identity services, this doesn't actually help my constituent who has been waiting now for over 5 years. So clearly something in the system isn't working. And as Patrick Harvey referenced in his opening speech, it's not just this issue. Hundreds of thousands of Scots are stuck on waiting lists on this government's watch. And it is possible to bring waiting lists down, but we need the government to get a grip. So I would ask the Minister in her closing remarks if she could let me know what hope she can offer to my constituent that she won't be waiting, as referenced in the motion, 80 years for an appointment, and if she could update me on what progress has been made on developing the support available for those waiting, in particular any local support within people's home health boards, not having to travel out with, and will she actually acknowledge that the scale of the problem warrants urgent action from the government? And I'll just end with the final quote from my constituent. Perhaps nothing will come of it, but at least they will know we're not sitting quiet any longer. Thank you.
Thank you, Ms Bialba. I call Maggie Chapman to be followed by Elena Whittam.
Thank you, Presiding Officer. The figures published by Public Health Scotland in October should shake every one of us in this chamber. They lay bare a crisis that is not abstract, not distant, but lived day to day by thousands of our fellow Scots. Nearly 4,000 people on a waiting list, fewer than 50 first appointments a year. And, as Scottish Trans put it so starkly, the most hopeful estimate being an 80-year wait for a first appointment. 80 years, a lifetime of being told to wait for the healthcare you need simply to live as yourself. This is not just a failure of a system, it is a failure of responsibility, our responsibility. The Strategic Action Framework has ambitious aims, piloting new services, reducing waiting times, improving trans people's experiences of healthcare. But we've failed to deliver on each of these. High-quality, gender-affirming healthcare requires specialist expertise. We need specialist clinicians who understand the complexities and nuances of gender identity care. But what we have heard loudly from many trans people is that they are being funnelled towards specialist services when that is not always necessary. If mainstream professionals, GPs, nurses, sexual health staff were properly trained and supported to provide routine transition-related care, then many people could get help more quickly, closer to home, without being added to an already overwhelmed GIC waiting list. Specialist clinics must be there for specialist needs, not because the rest of the system is unprepared. Training and education are therefore absolutely central. Staff themselves, in the recent Scottish Government evaluation, highlighted that training is underdeveloped. We are dealing with a recruitment crisis in this field, not because people do not care, but because there simply are not enough clinicians with the prerequisite skills. And when recruitment does happen, existing staff are stretched even further because it takes time, months, sometimes years, to train new staff to competency. We are nowhere near the critical mass of trained professionals required. And GIC work is demanding, emotionally, clinically, logistically. Staff regularly work far beyond their contracted hours. Many could earn the same or more elsewhere in the NHS without the relentless pressure created by those chronically long waiting lists. If we are to retain skilled staff, then grading and pay must reflect the reality of the work they do. Otherwise, we will continue to lose precisely the people we are most desperately keen to hold on to and keep. And let's be clear, long wait lists do not affect all trans people equally. Disabled trans people, minority ethnic trans people, homeless trans people, those in rural communities, very young trans people, older trans people. These groups face multiple intersecting inequalities. Some travel for hours, taking 3 or 4 buses just to get to an appointment. For some already dealing with anxiety or the hostile political climate we see far too often, that journey is unbearable. Inclusive, adaptable, regionally responsive services are not optional, they are essential. Finally, we must confront the simple fact that Scotland only has 4 GICs. Sandyford alone covers 8 health board areas and is the only service for young people. Scottish Trans have been unequivocal. Even if we expand the fund the existing clinics properly, this model is unsustainable. We need more clinics closer to the communities they serve, and we need them urgently. Presiding Officer, I am very grateful to Patrick Harvie for securing this debate. Now we need the Scottish Government to act, to ensure that trans people across Scotland can access the care they need without waiting a lifetime or paying to go private, and to build a healthcare system that is compassionate, responsive and rooted in dignity and human rights. Minister, please act.
Thank you, Ms Chapman. I call Elena Whittam to be followed by Monica Lennon. Ms Whittam.
Presiding Officer, I am speaking today in support of Patrick Harvie's motion and to express my deep concern about the waiting times we are seeing across Scotland's gender identity services. The figures published last month are not just numbers on a page. They reflect the lived experience of people in distress, people seeking support, and people who feel they have been left waiting for far too long with a never-ending wait ahead of them. And as someone with experience of a 5-year wait for neurocalm services, I understand acutely how difficult it is to be faced with such an unfathomable wait. No one in this chamber, not one of us, should be comfortable with the situation we see in the Sandyford Clinic in Glasgow, serving nearly half of Scotland's population geographically, with around 4,000 people on its waiting list and fewer than 50 first appointments a year. This is not the standard of care that any of us would wish to see. It is not what the Scottish Government set out to achieve, and it is not what trans people in Scotland deserve. When organisations such as Scottish Trans say that the most hopeful estimate is that you would wait 80 years for a first appointment, and remember that's hopeful estimate, that must give us all pause for thought. It's a stark reminder that despite our commitments and our ambitions, we have not yet delivered the meaningful improvements that are so clearly needed. And honesty is really important here. The Strategic Action Framework published in 2021 was meant to bring about earlier intervention, new pathways and a reduced waiting times. While some progress has been made in understanding demand and designing new models, the lived reality for patients tells us that the pace has simply not been good enough. And, Presiding Officer, I say this not to cast blame on those working tirelessly in our NHS, who have been open about the challenges that they face and who are striving every day to support people under extraordinary pressure, but to acknowledge the reality facing our trans community. Because behind each of those 4,000 names waiting at the Sandyford Clinic is a person. Perhaps a young person whose mental well-being will be deteriorating as they wait, an adult who has finally taken the difficult step to ask for help, or a family trying to support their loved one through uncertainty. And these people deserve compassion, respect and timely access to healthcare, just like everyone else. And I really hope that the government is listening, and that the Minister hears the frustration, and that she shares it, because we must recognise that this is a moment that demands urgency and focus. And I join my colleagues in the Chamber in calling for a clear and deliverable plan of action, one that expands capacity, that strengthens local services and ensures that no part of Scotland is left struggling on its own, and a plan that is genuinely co-designed with clinicians and with the trans community, and a plan that is matched with the resources and the political will required to make it a reality. And this cannot be about political point scoring. And it cannot be an extension of the culture wars that we have seen dominate the lives of trans people for the last few years. This is about dignity. It is about ensuring that our values of equality and compassion are reflected not only in our words, but in the services people actually experience and have timeliest access to. My trans and non-binary constituents deserve a service based in Ayrshire, and I'm urging the Government to work with health boards to ensure that they play their part, as it is simply inconceivable that the Sandyford Clinic continues to serve such a sprawling catchment area. Modern multidisciplinary services like the ones operating in Lothian and Highland are needed urgently. Both of these areas now have some of the shortest waiting lists across the entire UK, and they should be emulated. Like others, I've had casework where I've had trans and non-binary individuals come to me for support who have had to go private and then cannot get shared care. I had a young trans person tell me that their family was actually going without food so they could actually afford their medicines because they could not get access to a GP. Presiding Officer, I want trans people across Scotland to know this. You've not been forgotten, and I want our government to be committed, not just in principle, but in action, to building a service that meets your needs, supports your well-being, and does so without indefinite waits or impossible delays. I fear that anything else is a dereliction of duty that should be felt right across this chamber.
Thank you, Ms Whitton. I call Monica Lennon to be followed by Rona Mackay. Ms Lennon.
Thank you, Presiding Officer. I want to join colleagues in thanking Patrick Harvey for securing this debate. I'd also like to put on record my thanks to Paul McLennan for his recent motion marking Trans Awareness Week and Trans Day of Remembrance. I know that both of these debates mean a lot to trans and non-binary Scots and their families and their friends, and the fact that we're having this debate tonight reminds people that they are not alone. I shouldn't be shocked, but when I read and listen to colleagues discuss these waiting times and some of the data around this, it is truly shocking. If we were here debating the issue that people are waiting 80 years for cancer treatment, or 80 years for an appointment about diabetes or heart disease or any other medical issue, you know, it would be in the front page of every paper, there would be an emergency piece of legislation, something would be done. We are here tonight collectively to ask the Scottish Government, to appeal to the Scottish Government to do something. And it feels to me that the actions that people are calling for, including the Equality Network, you know, are within the gift of the Scottish Government. So we need to look to every health board in Scotland and ask them to step up. There needs to be some accountability. I can see from the stats in front of me that around 1 in 5 of referrals to the Sandiford are people from Lanarkshire, from my community. So what are NHS Lanarkshire doing? I know that the Scottish Government made additional funding available, but that didn't lead to any new services. It didn't change the outlook here, and I share the fear of colleagues that people are losing hope when you're told that the best estimate is 80 years for your first appointment, an entire lifetime. Of course, that's going to impact on people's mental health. So I think it's important we remember the human stories behind these statistics. I won't name constituents or people who've been in touch with me just to respect their privacy and dignity, but when you hear people say that they feel that they are being tortured, people who are experiencing menstruation every month who just cannot cope with that and they feel there is no support, people who are having to access the internet and the dark web to get hormones and medication without medical supervision, that is not okay. So we need to think about the safety of people right across Scotland. We also need to support the workforce, who often are at the sharp end of this, and it affects their mental health as well. So I would be interested to hear from the Minister tonight what work is being done around workforce planning as well. Just to reinforce points that have been made, but it's clear to me that we do need an urgent plan from Government to address and reduce the waiting times. We do need to see investment in distributed service models, so that care isn't just concentrated only at the Sandiford. And I think to Mercedes Vialba's point, because people need to access healthcare in their own communities, and we must address these staffing shortages and training gaps. Looking at the existing strategy, there's been multiple health secretaries, lots of different health ministers. We can't keep passing this on to the next person. So I think the Minister, I hope she'll hear tonight that in the chamber across the Parliament, she has MSPs who are willing to help her with this work and to make sure that we raise it with her and colleagues so that it is a priority. But we need to leave this chamber tonight knowing that the Government has a plan and that people will be able to find some reasons to be hopeful. Thank you.
Thank you, Ms Lennon. And I call Rona Mackay. Ms Mackay.
Thank you, Presiding Officer. Can I thank Patrick Harvey for bringing this important debate to the Chamber? We've heard some passionate and powerful speeches, and albeit with shocking content. I want to start my contribution by praising a young constituent of mine and his family. I met them in the course of the last parliamentary session and they made an everlasting impression on me. With full family support, along with his school and expert counselling, this youngster transitioned and is now an impressive, fully confident and happy young man who went on to university and no doubt will have a promising career. He is indeed a credit to his family. Now, his transition would have been made so much more difficult, may even have been impossible, without the clinical care and guidance he received at the Sandyford Clinic in Glasgow, as we've heard, the largest in Scotland. And while he was not without difficulties in his journey and did access private care at one stage to achieve the health care that he needed, he would have had to wait at least 6 years for his first appointment, maybe longer. Presiding Officer, to say this is unacceptable is an understatement. This is such a critical time in a young person's life, and it's inconceivable that they would have to wait that long for health care. So Sandyford has almost 4,000 people on its waiting list, an increase in almost 1,000 people from 2023. Now, I'm no arithmetical genius, but you don't need to be one to work out that with almost 4,000 people waiting and fewer than 50 appointments being offered a year, the most hopeful estimate is that you'd wait 80 years for a first appointment. My constituent and her son met with the former Health Secretary, Jean Freeman, just before the Strategic Action Framework was being established, and it was a hugely optimistic time. I remember that meeting well. This framework was meant to transform gender identity services and address long waiting times, included significant government funding to the existing services. Unfortunately, however, the waiting times for approximately half of Scotland now are significantly worse than they were when the framework began. It's true there have been a number of successes of the Strategic Action Framework, including the new National Gender Identity Healthcare Service Standards, a Transgender Care Knowledge and Skills Framework, and a reduction in waiting times for some of the gender identity services in Scotland. Lothian and Highland, which have been mentioned, now have some of the shortest waiting times in the UK. But that's no comfort to all those people trying to access Scotland's largest gender identity clinic, who could die before they can even have a first appointment. So what's happening here? Why are the waiting times so long? It could be, as we've heard, that Sandyford covers 8 of the 14 territorial health boards in Scotland and doesn't have the capacity to serve all the people referred to it. Anecdotally, I have heard of alleged staff harassment at Sandyford, affecting staff retention, and if that is the case, it's just beyond shocking. The second driver of the waiting times could be the model used at Sandyford. Scottish Trans believe that the service uses an outdated model that overly relies on psychiatry and psychology. And while important, clinics such as Lothian and Highland have updated their service model to incorporate more multidisciplinary models of working and have had far greater success at reducing their waiting times, and indeed some of the shortest in the UK. And this was evidenced in the Gender Identity Healthcare Evaluation of the Impact of Scottish Government Funding report, which showed that services that had used the government funding from the Strategic Action Framework to diversify their staff team and hire healthcare professionals such as nurses and GPs were able to lower their waiting times. And one of the commitments in the Strategic Action Framework was to fund new pilot services in Scotland, but this wasn't achieved, and I don't know the reasons for that. Presiding Officer, it is crucial that more staff are trained to work in specialist services and those who want to be able to deliver gender-affirming care, and that also GPs should be involved in this. 4 years ago, when the Scottish Government committed £9 million in funding and the Strategic Action Framework was established, the situation was poor, but better than it is now. Presiding Officer, trans and non-binary people in all our constituency and regions deserve access to health care and are currently in a situation where they're likely to die before they receive it. I don't think there could be a more powerful message to come from this debate, and I urge health boards and the government to reflect this. Thank you.
Thank you, Ms Mackay. And I now call on Minister Jenny Minto to respond to the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. Thank you, Patrick Harvie, too, for raising this important matter in the Parliament today. And for the opportunity to respond to the concerns outlined by Patrick Harvey and by Scottish Strands. I would also like to thank the respectful manner of all contributions in the Chamber this evening. I'd like to begin by speaking directly to all trans and non-binary people affected by the issues we've discussed tonight. I know that you are facing multiple challenges in this time of debate around gender identity, much of which is harmful and unnecessarily divisive. I would like to reassure you that this government sees you, supports you and remains committed to improving access to gender identity healthcare. I hear clearly the frustrations and share them. I have a simple view: people are people the world over. This commitment was made clear in December 2022 when we published the NHS Gender Identity Services Strategic Action Framework, outlining 17 actions to improve access to and delivery of gender identity healthcare. These actions were developed with a multidisciplinary team of professionals and people with lived experience of gender identity services. 15 of these are now complete, with the 2 remaining well underway. One of these actions was to commission Public Health Scotland, which has been referenced in this debate, to publish waiting times for gender identity services. This is the first kind of its data. This is the first data of its kind to be published in the UK, giving Scottish services an opportunity to properly determine where progress is being made and where there are clearly ongoing challenges to address. We can now properly scrutinise activity levels in gender identity clinics across Scotland. This highlights waiting times within NHS Greater Glasgow and Clyde specifically, which holds responsibility for a large share of the population, as every member has noted, and therefore faces unique challenges. However, in acknowledging these challenges, it is important too to note increased activity across gender identity clinics and positive progress being made. I appreciate it needs to go faster and further. There has been additional investment of over £5.2 million provided directly to health boards, and this is having an impact on first appointments in Lothian, Grampian and Highland, and also in activity across all areas. On first appointments, we know that in 24-25, 700 individuals had a first outpatient appointment, with an NHS gender identity specialist in Scotland, an increase of 101 people. There was also a clear increase in return attendances in 24-25. 6,527 return outpatients appointments took place, and this is an increase of 1,773. I appreciate wholeheartedly that these are numbers, and behind every single one of them is a person. In Greater Glasgow and Clyde specifically, where there has been focus on moving people through the service to free up capacity to bring people in, the data clearly shows an increase in adult return appointments, 354 in this reporting year. However, waiting times are only one indicator of improvement. Members will recall that in my September 2024 statement, I highlighted that an independent evaluation of the impact of our investment on both waiting times and quality of care was underway. This report, I just want to finish this paragraph. This report highlights that funding supported improvements across Scotland's gender identity clinics, including recruitment of additional staff to expand multidisciplinary teams, improved communications with patients, development of new resources and processes to support people on the waiting lists, and closer collaboration.
Patrick Harvey.
I'm grateful to the Minister for giving way, but she is drawing attention to areas where she says improvement is happening. I'm sure she does not deny that the situation facing my constituents is significantly worse than it was when the Strategic Action Framework was published. I think my constituents would like to know not a few statistics about where things are getting a little bit better, but what is going to be done to transform the areas where things have got so much worse. What can I tell them Can the Minister tell me what I can tell my constituents about what is going to change now?
Minister. I am finding this debate incredibly difficult. This is something that is close to all of our hearts, and I want to make a difference. I am trying to act. I am trying to make a change. I am working closely with officials and health boards, and if I may continue, I will try and outline what we are doing. Excuse me. The report also highlights specific barriers to improvement. This included the increased public, political and media scrutiny of this area of healthcare. As the largest service in Scotland and the only one providing care to young people, this is felt particularly in Greater Glasgow and Clyde. This often divisive attention and rhetoric we see has had a negative effect on staff morale, well-being and safety, and makes the recruitment and retention of specialised medical expertise particularly difficult, as Maggie Chapman and others have highlighted. The report highlights that despite challenges in a divisive, polarising climate, staff are exceptionally passionate about and committed to supporting patients and delivering the highest quality of care possible. And I want to thank staff across all the services who often work overtime and take on additional workloads while working in a very difficult and challenging area of healthcare. This situation is, as is usually the case, more complex than the statistical headlines suggest. Therefore, I absolutely accept that there is more to be done, particularly in GG&C, who are serving over 65% of patient population and also provide the only specialist service to young people. NHS Greater Glasgow and Clyde is all... I'm sorry, Jamie Green, I cannot take an intervention. My apologies. I'm happy to speak to you afterwards. NHS Greater Glasgow and Clyde is already taking forward a number of actions to improve waiting times, including introduction of clinical pharmacists, recruitment of an additional psychologist, introduction of nursing staff to improve waiting times, engagement with primary care to pilot increased use of shared care agreements. The Scottish Government also continues to work with NHS Education for Scotland to ensure the right training and development is in place across the healthcare, and with Public Health Scotland to further refine data collection. My officials and I are in discussion with health boards exploring how the additional funding can continue to support gender identity services, including working with health boards to establish appropriate treatment pathways through and between services and health board areas. Collaboration that Paul McLennan has spoke of, including support in home health boards, as Mercedes Villalba mentioned, and I know that health boards will have heard clearly this debate. I am very content to meet with others across the chamber, as Monica Lennon suggested, to see how we can move this further, because I hope you can realise how strongly I feel about this. Presiding Officer, it is right that all... I'm sorry, I'm not taking any more interventions. Presiding Officer, it is right that all health boards collaborate to ensure their patients can access the dignified care they need when they need it. Whilst gender identity waiting times may not yet be where I want them to be, I can assure all members, Scottish Trans and everyone currently waiting for treatment at a gender identity clinic, that we will continue to work across organisational and geographical boundaries to build on the improvements made to date and deliver the caring and compassionate services people deserve.
Thank you, Minister. That concludes the debate, and I close this meeting.